Hello and welcome. Today we're diving into hereditary neuropathy with liability to pressure palsies, or HPP. This inherited condition affects the peripheral nerves, making them unusually sensitive to pressure. Let's explore what causes it, how it manifests, and what can be done about it. NPP is primarily caused by a deletion of the PMP22 gene. This gene provides instructions for making a protein called peripheral myelin protein 22, which is critical for the myelin sheath. The myelin sheath is like the insulation on an electrical wire, wrapping around nerve fibers and allowing signals to travel quickly and efficiently. In most cases, the deletion is inherited from one parent, making it an autosomal dominant condition. However, in some instances, the deletion can occur spontaneously, as a de novo mutation. Now let's discuss what happens at the cellular level. The deletion of the PMP22 gene leads to a reduced amount of peripheral myelin protein 22. This deficiency disrupts the normal structure and function of the myelin sheath. The myelin becomes abnormally thin and folded, a process called temacula formation. These thickened, sausage-like formations along the nerve make it susceptible to damage from even minor pressure. This impaired myelin sheath slows down nerve conduction, and prolonged or repeated pressure can eventually lead to nerve fiber damage and loss. NPP is considered a rare disorder, but its exact prevalence is difficult to determine because it's often misdiagnosed or underdiagnosed. Estimates suggest that it affects approximately 2 to 5 people per 100,000 worldwide. It affects people of all ethnicities and typically presents in late childhood or early adulthood, although symptoms can appear at any age. Because it's inherited, having a family history of similar symptoms increases the likelihood of having HNPP. The signs and symptoms of HNPP are primarily related to nerve compression. These can include numbness, tingling, pain, and weakness in the affected limb. These episodes are often triggered by activities involving sustained pressure on the nerves, such as leaning on elbows, crossing legs, or repetitive movements. Common areas affected include the wrists, elbows, and knees. Symptoms can last for hours, days, or even weeks, and recovery may be incomplete in some cases. In severe instances, muscle atrophy and disability can occur. Diagnosing NPP involves a combination of clinical evaluation, nerve conduction studies, and genetic testing. Nerve conduction studies measure the speed at which electrical signals travel along the nerves. In HNPP, these studies typically show slowed conduction velocities in affected nerves. Genetic testing confirms the diagnosis by detecting the characteristic PMP22 gene deletion. A detailed medical history, including any family history of neuropathy, is also crucial for proper diagnosis. In some cases, a nerve biopsy might be performed to examine the structure of the myelin sheath, but genetic testing has largely replaced this invasive procedure. NP doesn't have distinct classifications or types in the traditional sense. However, the severity and specific location of symptoms can vary widely among individuals. Some people might experience only mild and infrequent episodes, while others might have more severe and disabling symptoms. The affected nerves can also differ, leading to variations in symptom presentation. This variability is likely influenced by genetic factors, environmental factors, and individual differences in nerve anatomy. Unfortunately, there's no cure for HNPP. Treatment focuses on managing symptoms and preventing nerve compression. This may involve lifestyle modifications, such as avoiding activities that put pressure on the nerves, using protective padding for elbows and knees, and maintaining good posture. Physical therapy can help strengthen muscles and improve range of motion. Pain management strategies, including over-the-counter pain relievers or prescription medications, may be necessary to alleviate discomfort. In rare cases, surgery might be considered to release pressure on a compressed nerve. While HNPP is a genetic condition and cannot be entirely prevented, there are ways to minimize the risk of triggering symptoms. Education and awareness are key. Understanding the condition and knowing which activities to avoid can help prevent nerve compression. Using ergonomic tools and techniques in daily activities and work can reduce strain on the nerves. Genetic counseling is also available for individuals with a family history of HNPP who are considering starting a family. The prognosis for NPP is generally variable. While some individuals experience mild symptoms with minimal impact on their daily lives, others may face more significant disability. The frequency and severity of pressure palsies can fluctuate over time. Early diagnosis and proactive management can help minimize the long-term effects of the condition. Recent research is focused on developing potential therapies that target the underlying genetic defect or promote myelin repair. Gene therapy and pharmacological approaches aimed at increasing PMP22 expression are under investigation, offering hope for future treatments. Continued research and advancements in understanding HNPP are crucial for improving the lives of those affected.